for Pin Media.
As a hospital, we opened as a regional referral in 2022, and since then we have been providing sickle cell disease care services. We have provided both acute care services, which we call outpatient services, inpatient services, and the chronic care services, which is mainly OPD services. The clinic that we run is basically run by the pediatric department with support from the physicians for the adult patients under our care. We provide newborn screening, which we do routinely. We test children up to 2 years. We usually send their samples to CPHL. We do support supervision for the lower health facility. We did a needs assessment for this, and we already know what is happening in our region. In the laboratory, we are able to do screening for all age groups. The reagents are provided by CPHL under the National Sickle Cell Program. We thank them for that. Sickling test samples are sent for confirmation still to CPHL, who send back our results, and we are able to send these results to our patients. Our patients are received at the medical emergency. I think you saw our medical emergency unit, where we manage complications and stabilize our patients. From there, we send them to the pediatric ward, where our warriors up to 17 years are admitted, and those above 17 years are taken to the medical ward. We have an HDU corner on the ward, where we put all admissions from emergency, stabilize them, and then we put them at the sickle cell corner for further management. As Kayunga Regional Referral Hospital, it's supposed to be an ICU, but currently being run as an HDU, where we put critical patients. We also do direct admissions from sickle cell clinic for daycare services. We usually admit them on the ward because we don't have a daycare center for these patients. The hospital admits an average of 15 sickle cell disease patients per week, and the main admissions are painful crisis, severe anemia, acute chest syndrome, and then we get a number of cases with sickle cell stroke. These numbers fluctuate based on the availability of hydroxyurea in the hospital. Under the chronic care, we run our clinic every Thursday, and we only admit those with reliable confirmatory test result for sickle cell disease. We usually rely mainly on the CPHL results. We make sure that we check their level of blood and other tests as they present. What are our achievements? We have been able to run a regular sickle cell disease care clinic, and we were able to identify space away from the ward. We started from the ward, but we identified that small space, and we have been able to increase attendances. We do regular CMEs for the new staff on management of sickle cell disease, and then we also we have had increased availability of medication. We used to have a small budget for hydroxyurea. It has increased, although it is still not enough, and we are continuing to lobby for more. Laboratory has supported us by prioritizing transfusion for sickle cell disease patients. We thank the Kayunga Regional Referral Hospital Laboratory for that, and also spearheading the newborn screening program. We have also been able to do testing under our school health program, and we have done screening, especially in secondary schools. We have done a needs assessment for sickle cell disease services in the region. Our challenges, we are still having issues with staffing. The team that runs the pediatric department has to, with the 2 pediatricians and intern doctors, plus the in charge of pediatric ward, have to run the sickle cell clinic. We have been able to receive support from people who are interested in taking care of the sickle cell warriors. We have 2 nurses, a medical officer, and we usually get support, someone from the laboratory to support our clinic. We still get challenges with stock out of medicines and supplies, especially hydroxyurea, PenV. Currently we don't have folic acid, and sometimes laboratory reagents, which make it difficult to monitor our patients in care. Stock out of blood, we lost some warriors in December and January. Those are 2 months where we are usually worried about taking care of our patients due to the stock out of blood. Referral of patients for super specialized services has been a challenge. Sometimes when we refer them to Mulago without a contact, they come back when they have not received care. So we thought that this would also be streamlined. Some of our warriors require ICU services. We are not able to do intracranial Doppler to identify those who are at risk of getting stroke. As a weakness, as a facility, we have also had our own weakness of ensuring that these children get routine PCV vaccination. We have inadequate space for running the clinic, as you can see, where we are, and we are not able to provide our patients with daycare services in our clinic. We always have to admit them on the wards, and they end up spending a night in the hospital, which is frustrating for the parents. Sometimes we have delays in the laboratory because one laboratory serves the whole hospital. Then there is also lack of regular training for the staff in management of sickle cell disease. Irregular monitoring, that is usually due to lack of reagents. We have a high level of malnutrition among sickle cell disease warriors. I don't know whether you have looked at our patients. A 13-year-old looks like a 7-year-old. Follow-up for the newborn screening results. Sometimes the parents do not give us phone numbers, so it has been another challenge getting these people to receive the results. So we recommend that, if possible, we can lobby for better space for the clinic so that we can have consultation rooms, daycare services, side laboratory, and maybe in future we can think about a one-stop center for management of sickle cell disease in the country. We also lobby for more staff to improve care and provision of enough medicines and supplies for these warriors. Regular training of health workers in care of sickle cell patients, and we also recommend that we support satellite sickle cell disease clinics in the region. We need to streamline referrals for the management of complications of patients with sickle cell disease. We also recommend that we have a point of care testing which allows same-day results. That's in our response to the patients who we fail to get when we do newborn screening.
Challenges of medicines, and importantly the challenge of space. When this hospital was renovated and upgraded, we got enough space to care for everybody. But as specialties in medicines increase, you realize that patients begin piling up one after the other. In particular, the sickle cell clients have nowhere to sit when the weather challenges. It is the commitment of government, and I want to request everybody here that in addition to the medicines, that we are glad we have received some donations so far, that the space constraint is addressed. My parent ministry, I know, is spearheading this, and I pray that they continue doing so.